Hello, my name is Andrea Sinclair and welcome to my video regarding the dissection of the sheep heart. I have several areas of the sheep heart that I have to identify for my assignment. So if you'll bear with me, I'm going to stand, which will not make me facially visible, but I will try my best to meet the points that's expected for my course. Okay, let's begin. Thank you. First of all, I'd like to discuss the visceral pericardium, and I'm going to make this as visible as I can. The visceral pericardium is the outside layer of the heart, and this is my sheep heart here, is the outside layer that should be visible. Epicardium. I want to point out the apex, which is this pointy area where I have my instrument, and the base of the heart, which is a little bit lower here, the base or bottom, I like to refer to it. I want to talk about the right and left atria. To answer the question, blood in the right atrium happens to be deoxygenated. The right part of the body would be the area, let me see if I can divide this, the area of the heart I've already dissected. The right atrium is the area where the blood enters from the body, and it comes back deoxygenated. It is then going through several valves that come in from the upper and lower body, and then it gets distributed over to the pulmonary system or the lungs for oxygenation. So to answer the question, is the blood in the right atrium oxygenated or deoxygenated? Yes, it's deoxygenated. And the blood in the left atrium becomes oxygenated after it has made its course to the lungs. The right and left auricles, they receive blood and they transport. The right and left ventricles, which the ventricle area, hopefully you can see where I'm pointing. The interventricular sulcus, there are three major blood vessels inside of the sulcus area. The pulmonary trunk, where is the blood going to? As I previously answered that, it's going to the lung, and it is deoxygenated because, as I want to explain, when the blood comes in from the upper body or the lower body, it is deoxygenated. It has been transported through the body. It has to come in, go through the different valves, the bicuspid valve, the tricuspid valve, and then it's transported over into the lung through the pulmonary artery, I believe, and then it becomes oxygenated through the lungs. It's transported in through the pulmonary vein, I do believe. We're going to talk about the aorta. The aorta, which is at the top, right there. The aorta is the largest artery, or the main artery, where it pumps blood from the left ventricle, and the aorta brings the blood in, and it's deoxygenated. Then you have like the ascending aorta, and the aorta has this aortic arch and three main vessels. The brachiocephalic artery, the left common carotid, and the left subclavian. Okay, it would all be in this general area here. I'll review those areas again. The brachiocephalic artery, left common carotid, which is transports blood to the neck, and then the left subclavian. You have the superior vena cava, superior vena cava, which is upper, and then you have the inferior vena cava, which I'm pointing toward the lower. The superior vena cava allows blood to be transported from the upper body. The inferior vena cava transport the blood from the lower body. Then you have the coronary sinus, and there's three blood chambers where blood goes through the coronary sinus. And to answer the question, these are veins. Is the blood oxygenated? Once it gets into the level of the veins, it becomes oxygenated because it's returning from the lungs. Now I want to point out the internal anatomy of the heart. The pectinate in the inner wall of the right atrium. The pectinate looks like little veiny areas. The myocardium, which is the muscular, more of the muscular part of the heart, and it's inside. And why is the myocardium thicker? Because it has to pump the blood out from the into the rest of the body once the blood has become oxygenated. And then you have the little veiny areas, the trabeculae carneae, the bicuspid, which is more the upper, the valve, upper valve, and then you have the tricuspid, which is more lower. Let me see. This is a lower tricuspid, and the bicuspid. The bicuspid is where the blood comes in from the upper body, and the tricuspid, it comes in from the lower body. And then you have the chordae tendineae, which is somewhere in there. The cusp of the valves, the papillary muscle, which would be right in there. The pulmonary semilunar valve, I believe it's somewhere in the pulmonary semilunar valve, and the aortic, which the aortic, I'm going to close this maybe to get a better demonstration. The aorta is at the top, and the aortic semilunar valve would be somewhere located where I'm pointing to. Okay, thank you for this presentation, and this concludes it.